While the overall number of COVID-19 cases has fluctuated across the state, recent outbreaks on Lānaʻi and Hawaiʻi Islands show just how quickly the virus can spread. With no end in sight, we'll check in with the state's top health officials for the latest on hospitalizations, supplies, and contact tracing. We'll also hear from a University of Hawaiʻi researcher on the effort to create a possible vaccine. Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Yanji Denise. Around the world, health and medical experts continue to learn more about the COVID-19 virus. Lockdowns and other safety measures have helped to manage the number of positive cases in the state, but many say until there's a vaccine, these precautions will have to stay in place. Our panel tonight includes the medical professionals leading the state's fight against the spread of the virus, as well as a vaccine researcher and a doctor who survived COVID-19. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and on the PBS Hawaii Facebook page. Now to our guests, who are all appearing via the internet. Lieutenant Governor Josh Green is the state's COVID-19 healthcare liaison, a physician himself who overcame the virus. He's also leading the state's pre-travel testing program and vaccination strategy. Dr. Libby Char is an emergency physician. In September, she was appointed by Governor Ige as the new director of the Department of Health. Dr. Leah Pasqua is a practicing pediatrician in Wahiawa, Central Oʻahu. He contracted COVID-19 in March and spent 10 days battling the virus in the ICU. Dr. Alex Lehrer is an assistant professor at the John A. Burns School of Medicine. He's leading a team of scientists in developing a coronavirus vaccine. And Darlene Nakayama is the CEO of Palolo Chinese Home in Honolulu, which provides a number of services, including hospice and adult residential care. She holds a bachelor's and master's degree in nursing. Thank you all for being here tonight. Dr. Char, I want to start with you. As we mentioned at the top, you've been on the job now for about 2 months. Tell us, how is the state doing?
Well, you know, there's a lot of hard work going on at the state, a lot of concerted efforts to get people tested and do some contact tracing if there's a positive test, and then also to, keep people in safe spaces where they can quarantine or isolate if they need to. It's amazing how many people here are really the experts in the field. A lot of public health people doing a great job, and I think the state is doing better overall.
Dr. Green, we have a lot of visitors now joining us. The pre-travel testing program is in full effect, but we do see the cases starting to really rise on the mainland, and a lot of people are concerned about the travelers who are coming in, especially as we approach the holidays. Can you tell us how you think the travel program is going and if our community is safe?
I think it's going very well. We have the second lowest rate in the country of COVID, and since the October 15th start date for safe travels, we've seen, I believe the number is 232,524 travelers come to the state of Hawaii. Of those, 204,798 actually completed the test or got cleared that way. So we've done something that no other state could accomplish, but it's not perfect, of course. As we've heard from Dr. Fauci and Dr. Char and others, the virus can get in. The truth is, the spread that we've had has been community spread. It is always going to be possible that a case can come in through the cracks. We think it's been about 18 out of the 15,000 that my surveillance program has done, and I'm sure there are more cases, but a very, very small number as compared to what happens when a large gathering occurs and people aren't wearing masks, or the outbreak that we had on Lanai. It's just going to spread if we don't have masks on, and our mask rates can't keep it at bay completely. So some successes, some near successes, and an occasional failure, but I think almost everyone else would rather be Hawaii than the other states in the country.
Ms. Nakayama, let's talk about nursing homes for a moment. I know that on Hawaii Island, one of the big outbreaks there, of course, was at the Veterans Home in Hilo, and a lot of people have a lot of concern for elderly residents who contract the virus. Tell us about what you've been doing at your facility to try to keep residents safe.
Well, first of all, I really want to assure the public that nursing homes have become much more safer. And I think over time, we've learned and gotten better on ways to keep our kapunas safe. We are, in our nursing facilities, are very strict with what we call surveillance, meaning that we are watching for any potential risk of infections and exposures. And employees are screened before their shift and ongoing throughout the day. If employees have any possible exposures, they have to stay at home, quarantined until they're cleared to return to work. We also have taken steps to quarantine any new admissions that come into any nursing facility for 14 days, which is the incubation period, to ensure that no one comes in with COVID-19. We also test employees based on the county's positivity rate. So the higher the rate, the positivity rate, the more we have to test. So currently with the positivity rate, and hopefully it'll stay low, we currently all test our employees every month. And in addition to all of that, our residents wear masks, we keep them 6 feet apart. We also are very, very keen, and we watch them very closely for any signs of infection. And even with a slight cough, it gets our attention. So we are really very, very careful in nursing facilities right now.
Dr. Pasqua, I know that you contracted COVID-19 on a trip to the mainland back in March. Can you tell us a little bit about your experience? We mentioned at the top that you spent 10 days in the ICU. Tell us how you're doing now, and if you could walk us through a bit of that experience.
Okay, so on March 12th, my family traveled to New Jersey to go to my daughter's engagement party. And then when I was there in New York and New Jersey, I noticed that I knew something was up, because then I'm listening to the news and I'm hearing about things happening in nursing homes and something's kind of going on. And then the impossible happens. Broadway closes. I mean, New York, Broadway closes, something's up. That happened on March 18th. And then I came home, and on March 22nd, coming home, I started to feel very, very bad on the plane. For the next week, I thought, well, maybe it's the flu. So I had one of my colleagues kind of watch me with that and maybe give me some medication for some flu medications. And then as the week went on, I had a hard time breathing. And so I asked one of my colleagues to bring me a pulse oximeter. It's one of those things that helps you see how you're breathing. And by then I knew something was up, and I thought, I need to get COVID tested. And so I went to Queens, and they tested me. The results went to, I went to Queens West. The results went to the CMO at Queens downtown, and he calls me up and he says, "Hey, Pasqua, you're positive. How are you feeling?" And I said, "I don't feel so hot, and my oxygen saturation is 84% on room air. And usually it's up there at 95. So he said, "You need to come to the emergency room." And I remember driving myself to the emergency room and going up to the ICU. And next thing I knew, they were kind of dancing around the possibility that I needed to be intubated. As a clinician, I know what that's like. And so at that point, I was thinking, if you need to intubate me, then just go ahead and do it. And next thing I know, 36 hours later, they come busting into my room at midnight saying, "We're going to need to intubate you." And then for the next 10 days, I remember drifting in and out of consciousness. Yeah.
And how are you doing now?
Now I'm doing okay. Again, as I mentioned before, I don't know the reinfection rate. It's possible. So I'm living every day thinking, I don't want to do that again. But in case that happens, I need to get respiratorily in shape. So I've been trying to watch my diet and lift weights and do as best as I can. Every once in a while, I may feel a little bit tired, but all in all, I'm doing much better than I did before. When I came home, I couldn't walk up 3 steps, not 3 flights, 3 steps. So, but now I remember when I came home, I had to practice just standing upright for a minute. It took a while.
Wow. Well, Dr. Lair, and forgive me, I know I mispronounced your name at the top, Dr. Axel Lair, thank you so much for joining us tonight. Tell us a little bit about the work that you're doing with vaccine trials and the research that you're doing with the medical school.
Yeah, so thanks for having me. I think the main message that I want to give out here is that, the entire medical research community was, really leaping at this in order to do whatever we can, to address this issue. And of course, I'm a vaccinologist. So of course, my team, I mean, we very early in February had meetings and we made a decision that yes, we will try to use our platform of vaccine to actually address the COVID crisis. So we are actually, we are developing a recombinant subunit vaccine. So we're doing that normally for viruses like Ebola virus and so on. But it just so happened that we recently made some breakthroughs in thermostabilizing our vaccine, which means that you can actually dry down the final product, and then you can leave it on the shelf. You don't need refrigeration. So we said, okay, this is absolutely what would be required for a vaccine where you need billions of doses all around the world. And so my team has really worked hard. I really have to commend all of them. I mean, you know, this is students, postdocs, all of my staff. We are basically running double shifts to just, you know, kind of address the issue. And we have some promising data now, but of course, we don't have a vaccine in phase 3 clinicals. But we're very happy to see that some vaccine candidates are getting pretty close to actually telling us that a vaccine is possible.
When we say pretty close, I mean, what is the time frame for something like that? I know that we hear about vaccine successes and in a lot of the testing that's happening internationally, but realistically, when do you actually think that we'll see something on the ground where someone in Hawaii can go to a doctor and get a vaccine?
Well, as you know, this week, Pfizer has reported greater than 90% efficacy with their vaccine candidate. They are already in manufacturing of millions of doses, and they're promising 1.3 billion doses of that vaccine next year. There's, of course, some caveats with these vaccines, so we don't know exactly how well they can be distributed. But at least the numbers will be there. We will probably start seeing something, I would guess, before the end of the year. But this will be, of course, first for a small segment of the population, and to become available wider, I would say next summer. This is what the prediction that I made actually early this year. It was just a gut feeling. Normally, we take 15 to 20 years to develop a new vaccine. So this is really unprecedented. This speed is unheard of. And yeah, I think we're getting pretty close.
Well, that is encouraging. And absent that, of course, we will have to continue to do things like wear masks and socially distance. I have a pile of questions here. Dr. Char, I want to start with you on this one. Has there been David asks, has there been a documented case of a person getting COVID while diligently wearing a mask?
Don't know. I suppose it's possible. I don't know about all the cases because I'm not on the investigation end of it. But it's so difficult because we don't know at what point you got exposed or, you know, what your circumstances were. And none of us wears a mask 24/7 because you got to take your mask off to eat and whatnot. So I suppose it's possible, but I don't know specifics on any one case.
Ellie in Oʻahu asks, and I'd love Lieutenant Governor Josh Green to weigh in on this one. I know that you and others in leadership have been calling for a statewide mask mandate beyond what is in place right now, moving it to something like a traffic violation, and so that it would be very easy to write tickets, if you will. Ellie in Oʻahu says, why doesn't the governor issue a statewide mask mandate? Can you tell us a little bit about why, if this is something that people are calling for, it hasn't happened?
Sure. It's really technical in many ways. The Gov has expressed that we have to all be wearing masks. So to that extent, he has mandated that we wear masks. But the way the law is built, we can only do one thing right now, which is have the police and the sheriffs apply a $5,000 up to $5,000 fine or a year in jail based on the misdemeanor charge for a violation of quarantine rules. And we need the legislature, if we're going to change it just to a simple fine, we need to have them come in and change the way the fines work. So we have that language written through our Attorney General, and it is important. If you look across the country in places where, well, two counties right next to each other, they're given the option, one to have a mask mandate and everyone has to wear it or get a fine, and the other can choose not to. They saw that there was between a 50 and 61% decrease in the cases with that mask mandate. Now, these laws are only as good as how people follow them and how well we can enforce them, but it would help us immensely. And right now, people, based on the governor's orders, have to follow the county rules, which all vary a little bit. I can tell you that as of this last week, the 7th, Big Island had a little bit better rate. They ticked up to 86%. Oʻahu dropped to 83%. Maui was at 85%, and Kauai was at 76% mask wearing based on the surveying. And when you have rates that are down in the 70s, you're going to have a lot of spread. And unfortunately, that's what we're seeing. So I'm a major, major proponent of a mask mandate just for a time until we get to the other side with good vaccinations and immunity.
This question is also for you, and it goes to the travel program. How many travelers have gotten sick since arriving?
Well, we've tested over those 15,000 people, how many got positive. Actually, none of them were sick. All of them, it was 18 individuals, 18, ended up testing positive and having a confirmed positive. Now, we've had a couple other people, and this is a challenge, didn't have their test results in their hand. They hadn't got the result back before they traveled. And then when they landed or somewhere in the air, they got emailed their result and they were positive. Again, to my knowledge, asymptomatic people. There are going to be a few cases, but the rate's been under 1 out of 800. I think it was 1 out of 842. So, I know people would love to test everybody all the time. I would too, but we don't have that kind of resource, and it is extremely difficult to get people to test after coming. So it's a very small number. We are in discussions with all the leaders trying to decide maybe we have to have people have their result done before they even consider getting on that plane. It's again, easier than it may seem, but we may continue to push on that as soon as, because you see the numbers on the mainland really surging high.
Dr. Pasqua, I want to draw on your experience not only as someone who's experienced the virus, but also as a pediatrician. There's a lot of concerns about pediatric cases. We haven't seen that many, as to my understanding, here in Hawaii. But what do you say to parents who are concerned, particularly when they're deciding whether or not to try to push for in-person learning come January and in the months ahead?
Well, that's a good question. I let them know that things are very, very much in flux. I also tell them to get in touch with the school to see what measures are being taken. I sit on the board of a small little school in Wahiawa, and so I give them some advice as to how to space the students. But the also thing that happens is that every once in a while, maybe a parent will say, "Hey, how come my child can't go to school?" And they will start to kind of give the administration some flack. At which point I tell the administration, you know what, refer the patient to me, refer the family to me. And I'll explain to them why we need all hands on deck to cooperate with all of this. Also, as a pediatrician, and I let parents know that what we were hoping is that we would have been able to deal with COVID before flu season came in. And now we have COVID and possibly the flu. How is that going to interact? How is that going to load the hospitals? So I'm telling parents, if at all possible, yes, go have your child get all the immunizations, get them all cut up, get the flu shot, because flu season is on the way. We do not want to deal with COVID plus flu.
What's your thoughts on in-person learning? Is it something that you advocate right now, or is it something that you think that we should hold off on?
I would hold off at this point. I know that it's very, very difficult, but again, we're really going to have to clamp down on things. For example, Dr. Green, one thing is that I listen to his stats every day, and I always think, what would it take to hear some magic words from him? And those magic words would be, we've had no new cases in 14 days, which is a regular incubation period. What would it take? Would it mean keeping all the kids home for 2 more weeks and a whole lockdown? Whatever it takes to hear those words.
Dr. Char, what are your thoughts on in-person learning right now?
We've done a fair amount of work to help come up with guidance for the schools, and it mirrors some of the reopening measures. I think a lot of the question depends on what can the schools do to mitigate infection and transmission. And so it's not just a matter of, how many cases have we had or anything like that. It really depends on the individual schools. Obviously, the education is just so important for kids and especially younger kids. But we need to balance it. We need to do things safely. So I think with the metrics right now and working with the DOE to help provide some guidance for them, I think the schools are doing a good job in looking at, how can they do things safely? Can they do things safely? What measures do they have in place to mitigate? And based on that, they're making the best decisions that they can.
Dr. Lehrer, you mentioned that you think that next summer, hopefully, is when we would start to see a vaccine start to roll out. What kind of a difference will that make? Do you think that by, if this school year is all at home, do you think that we will have more blended or perhaps full in-person learning given that vaccine rollout over the summer?
So, of course, my hopes are actually that the rollout will start sooner than that. But the main point will be to reach a certain level of immunity in the population that we can start to feel a little more confident about these in-person interactions. So I would think that as soon as sufficient numbers of doses of vaccines are available, that then that will actually be rolled out pretty quickly. I can't give any prediction really, but one of the things that really makes me happy as a vaccine developer this week is that we actually, since Monday, know that a vaccine is possible. So, when we started this entire endeavor, nobody was sure if we were going to be able to develop vaccines that would be efficacious against infection. And that has been shown now very clearly with the first clinical trial. So I'm really very hopeful. As soon as we have vaccines, it will take several months, and you will have to ask the state officials here what their estimates are. But I'm sure nobody knows this right now because there's distribution problems. There will be manufacturing issues. So even if there's hundreds of millions of doses of vaccines available for the US, it will take a while to get that to each and every one, and you will most likely need 2 shots.
Dr. Green, I know you come at this not only as a clinician, as someone who experienced COVID, and as someone in government, but also, of course, as a dad. What are your thoughts on in-person learning?
In-person learning, absolutely, but we'll have to have a very short fuse to pull back if cases surge, if there's any risk. And I won't blame any family or teacher or child if they decide it's still time to stay home. We kind of have a split household right now. Maya, who's 13, beautiful tiny love of my life, right? She's in school right now and doing great. She's over at Iolani. Sammy, the most wonderful little boy you could ever hope for, he's at home, and his charter school is not ready yet. So we accept that. We spend a lot of extra time with our kids and teach them. Jamie's doing a lot of teaching this year. So everyone's going to have to work their way through this. We will have to also accept that this year is going to be different for everyone. It's different for some people in business. It's different for our kids going to school. It's different for health professionals. It's different for everyone. So I'm fully accepting of whatever people decide, from school district, school area to school area, and family to family.
Ms. Nakayama, I know you have a lot of elderly residents who I'm sure would love to see family members, especially young children. What's been the policy for you, and how do you make those visits safe, if at all?
So the good news with the nursing facilities is that the government, CDC, recently loosened up the visiting guidelines. And so that's good news for all of us. Here in our community, though, with the open visitations, of course, we still have strict screening. We still make sure that there's social distancing. And in our facility here, Palolo Chinese Home, we use plexiglass protection. Because Palolo has a really nice and open environment, many of our visits do take place outside, because studies have shown that the incidence of COVID spreading on the outside is much less. So the good news is that we've opened up visitations. We do welcome children, although those visits have been restricted to drive-by visits. So we'll have a car full of kids and balloons and those blowy things, but they're restricted to their cars, and the kupuna sits about 6 feet away, and it's just such a joy to see even that. So I think we've kind of tried to, as much as possible, open visitations, and of course there's always a lot of FaceTime. So
Yeah. We just went through Halloween, of course, and the Department of Health was, the state was very clear on what the guidelines were, basically trick or treat at home and, have your own parties. But Dr. Char, what are you recommending for the holidays? People love to gather. Of course, this is Hawaii, and family is so important, as it is everywhere. And these holidays are so important to all of us. So what are you recommending for Thanksgiving and beyond?
It's such a special time for our families, and I think especially our local cultures. It's all about socializing and family and being together, and I think we can celebrate the holidays, but we just need to do it smartly. So I think for this year we're going to have to take a pass on having big gatherings and lots of people over for large potlucks. Have small groups. Right now the city is at a level where you can have 5 people together. Have Zoom chats, telephone calls, anything like that. You can reach out to others on the mainland. You can reach out to others even, down the street from you. But we just shouldn't be gathering in large groups together. If you are going to gather, could you sit out in the yard and pull up your beach chairs and everybody sit out in the yard and space apart? Pre-portion the food on the plates, or have bento or something where everybody has their own containers, and just allow ourselves to keep that distance. Because we know that if we wear our masks, if we keep our distance, that's going to help to keep us safer. And wouldn't it be terrible if we got together over the holidays and then ended up getting each other sick?
Well, and to that end, as you noted, wearing a mask is recommended, but Larry and Makiki is asking, can you wear a face shield instead of a mask? How effective are face shields?
Yeah, the face shield will help anything that you're exhaling and the droplets from going forward, but it's really not effective in terms of virus particles when you're exhaling. If you cough or sneeze, or even just speaking loudly, the virus particles will hit the face shield and come down, and they've got models that you can see. If you Google it or you go to YouTube or something, they have models where you can see the vapor coming out and spreading out. So it's really not as effective as wearing a face covering, a mask.
Dr. Green, we just have so many questions, so I'm just going to keep calling on all of you with all of them, and thank you so much to our viewers. We really do appreciate this. Dr. Green, someone wanted to know, I tested positive for COVID. I did my quarantine. I was told that the virus can stay in my system for 3 to 6 months. Why are people allowed to be out interacting? So tell us a little bit, especially as someone, a clinician and someone who's gone through this, about having virus in your system and what that actually means.
Sure. So the science has shown that people are infectious for a pretty short period of time. The CDC and others across the globe have recommended that after 10 days after your first symptom, if you're no longer symptomatic, then you're not going to be infectious. So that's a 10-day window, unless you had severe illness, and then they extend it to 20 days. After that, when someone told that nice person that they are going to still have the virus in their system, what they really are saying is they may test positive. They may have particles of the virus still in their nose or in their upper airways, but they won't be infectious. And that does end up causing a lot of concern because there's still so much we don't know. Could someone be infectious past those 10 days? Maybe, but we're talking about probabilities. And for the most part, that's not the case. So after 10 days, after I had no longer any symptoms, I was very lucky. I was different than Leah. I had symptoms just for 2 days. Real bad aches, and my skin was very, very sensitive. I did develop a little bit of a cough later, but I never had a bad lung problem. So for Leah's case, he probably would have been told you have to spend at least 20 days away from anyone because he was hospitalized, had those very serious challenges. Thank God he came through. For me, it was 10. Now, we may continue to learn a lot more about this virus, but we also have to know that life does go on. Did I wear a mask even more religiously than before? Of course. Did I spend all that time away from my family? You betcha I did, because I was so afraid of infecting them and my coworkers who I adore. But it's the 10-day window. And that was one of the very distressing things about what went on the national level when we saw large gatherings at the White House and people not wearing masks and some people even being sick and going back out again. you just, you have to take personal responsibility. And it's bad enough that you have to isolate. Isolation is very hard. I'll tell you, that's the hardest part in some ways of dealing with COVID, but you still have to be responsible thereafter. We may find later that people can get infected again. We may find that the vaccine is really super protective, but we're going to study these things and then we can give better advice going forward.
Yeah, Dr. Pasqua, I want to turn to you on this also. This reinfection question, of course, is one that I'm sure that you're paying close attention to. And what do we know about why some people respond, as Dr. Green did, with a 2-day, course of illness, and in your case, some, getting very severely sick?
It's almost random. And the reason why I'm going to say that is because everybody else in my family tested positive. And so contacted my family, hardly had anything at all. My son lost his sense of taste for about a week. My wife then had some upper respiratory symptoms. And meanwhile, dad's intubated and ventilated in the hospital. So that means for 5 days, they were at a state of uncertainty. They were looking, going, is that what's going to happen to us? It's quite terrifying.
Yeah, it does sound that way. And what do we know about reinfection?
I don't know. I don't really know the data on that.
Well, Dr. Lara, I wonder if we can turn to you on that.
Well, I mean, there have been now a small number of cases of persons contracting SARS coronavirus 2 that causes COVID to a second time. But it is a relatively small number. And therefore, I think we can all be hopeful that if our body has responded properly, that you will not incur a second infection. So I would hope that Dr. Pasqua definitely put his body through the virus put his body through the full program, meaning that now he has a robust immunity. I hope, of course, the same for Dr. Green, but we don't know that yet. And these are actually those important markers, that are coming hand in hand with when you develop a vaccine. Like I said earlier, we did not know until earlier this week whether a vaccine can protect. Same thing as we need to study the immune response. We need to learn that clearly, and it is possible that you can contract the disease a second time.
We have a question directed to you, so we want to stay with you on this. The caller is asking, is the vaccine coming out a prevention, or are you working on a treatment, or are you working on both?
Well, so the vaccine by itself is a prevention. So it would actually work to prevent somebody who has never had the virus from getting sick and actually getting infected and getting sick. But then actually, and that is where the treatment portion comes in, we believe that the entire population will have to have a level of immunity. Therefore, even people who may have contracted the virus before may still need this vaccine. And then on top of it, we need to also keep in mind this may turn into something like another annual flu shot. So we need to be ready for that, because nobody wants this to go away and then maybe come back to us a year or two later, and then possibly even causing mutations that might make it an even worse virus. So I think we need to look at that, and therapeutics and vaccines are very close together.
We have a question from Richard for Kaneohe, and it's for the whole panel. And I wonder if by a show of hands, if you folks could answer this. If a vaccine is available soon, January 2021, would the panel take it? By a show of hands, can you tell me if you would take it? So it looks like everyone would. I know, Dr. Green, you are the task force for the state working on this. What are your concerns about people actually being willing to take this, especially because this has become politicized to a great extent?
We had an extraordinary meeting today. Director Char and I and General Har and I think 183 people from across the country. We're worried that a lot of things. Number one, that we are really racing to get this vaccine in play. Like the professor and researcher said, normally you spend years and years doing this, and this time, because it's a global pandemic and a concern of mythic proportions, we had to rush and get there. So we have to assess it really carefully and make sure they're not missing any side effects. Sometimes vaccinations can cause challenges to people. They can cause neurologic damage and other things. But for the most part, vaccines are very safe. I mean, incredibly safe. And I do support them. I don't demagogue the issue. And if people choose not to, I understand. I accept that. I celebrate everyone's life decisions, but we are a little wary of the speed of it. We also do only have preliminary data on the Pfizer vaccine. It was great that they said over 90% success rate, but it's a pretty small number of people that they actually got that data from. So that's another concern. There are other concerns I have. For example, if we're going to have 2, 3, 4, maybe even 5 vaccines that we get done over the course of this year. If one of them or multiple vaccines cause problems, it could send the whole world thinking maybe vaccines aren't safe, maybe vaccines aren't the right thing. Meanwhile, our pediatric community survives because of vaccines, in my opinion, strong opinion. We don't have meningitis. We don't have polio anymore. We don't have measles here. I went to Samoa with wonderful people. We saw many people dying of the measles because they had an outbreak just last year at this time. So I don't want to see any slippage backwards on vaccinating people in our planet. I think it's going to work. I'm going to take it. My family is going to take it. I'm going to take it on TV probably so people see that it's real, but people still have to make their own minds up. And we do have to be careful. I think that our Department of Health will do a great job vetting it.
Dr. Lehrer, I wonder how many people, what percentage of the population, let's say in our state, need to actually get the vaccine for it to make a difference for us?
Well, that's, their epidemiology comes in, and typically we would expect with the virus, with this kind of replication or with this rate of spreading, we may need something like 60 to 70% at least to be safe. And again, I think I want to really go back to the point that Dr. Green was making. Safety in vaccines is the utmost importance, because we cannot inoculate somebody that is totally healthy and then later on they have some side effects. This can happen sometimes only at 1 in 100,000 or 1 in a million, but you don't want to be that one. So that is why vaccine development over the last decades has gotten very safe. And there will be different vaccine candidates, and not every vaccine will be the right one for every person. So that is why it's so important right now that there's a variety of vaccines coming, and that will help us to get to that high level of vaccination rate that we need to get. It needs to be higher than the seasonal flu vaccine take.
60 to 70% certainly is a lot. Dr. Char, we have 2 questions here about health and prevention that I wonder if you could answer. Dennis in Honolulu says, studies show that iodine in multivitamins is effective against COVID-19. Is this true? And then someone else is saying, does diet affect your recovery from COVID? Does it cause you to contract it? What are some things, absent a vaccine, and of course, in addition to wearing a mask, but what are some things that you can do? Dr. Pasqua talked about getting your routine immunizations, but what are some things that you can do? And what about this, about iodine and multivitamins and things like that? Are there over-the-counter remedies that you can take to sort of, make yourself healthy and prevent contracting the virus?
I haven't heard about iodine. We have to remember that this is a novel coronavirus. And so, we're learning day by day, and as more research comes out and as it gets studied a little bit better. Thus far, I've read a bunch of papers that seem to show that I think there are a few things that seem to help: vitamin D, zinc. There were some of the H2 acid blockers that seem to help. I haven't heard anything about iodine helping. I don't know if Lieutenant Green's familiar with anything like that, but I haven't heard about the iodine. But there are some other things that seem to show some promise. Conversely, I think your question was, do you get sick based on diet? And I don't know of anybody getting coronavirus based on diet. As Dr. Pasquale was saying, I think we should be paying attention to overall health and being healthy and making sure that we're having healthy lifestyles, getting enough exercise and sleep and eating well and being healthy. I think that's probably a good defense as well.
Okay, and Ms. Nakayama, I want to bring you back into the conversation. We touched on the holidays a little bit earlier, but what are some of the plans that you have for your residents? Because of course, this might be a time when residents would have an opportunity perhaps to leave your facility and go be with family. What are your recommendations for your residents and for other care homes in our community?
So I'm sure many of the facilities and organizations are getting ready for the holidays. I mean, it is a special time, and we would just hate to limit the socialization and the interaction with the families, because having family around is just medicine in itself. So I was just thinking back of our planning here at our organization, Palolo Chinese Home, and I believe that we have about 20 plus events coming up. And what it is family members with one or two visitors behind a plexiglass with tables that are really far apart. And we'll be providing them with holiday dinners and some games and some a really nice holiday turkey dinner. And at least it'll give the family members an opportunity to at least see each other during the holidays. I mean, it is a special time, and I know that we have to really pay attention with social distancing and really keeping everybody safe. But I think with our plans here, and we have a huge community room, that we'll be able to safely distance people and still have them have a really nice meal and have a great time. So we actually have these plexiglass things. You probably see them in the bank. So we have garlands and holiday bells and everything to just get everybody in the holiday mood. So hopefully people will have a good time, even with COVID-19.
I'm interested to also know, for people who, might have family members who are now entering a residence like yours, are there new rules in terms of admitting new residents and any protocols that they have to go through to keep the rest of the existing residents safe?
Well, we do require a negative COVID test. And after that, once they're in a nursing home or any type of facility, a lot of us are placing these people on a 14-day quarantine. And what that means is that they're on what we call a droplet isolation. And we take special care to be sure that if they become COVID-19 positive, because there is a window of 14 days that they can become positive, 10 to 14 days. So we're extra careful to not have them interact with the general public until we're really sure that they're COVID-19 negative. So
thank you so much.
Other than that it's pretty a routine admission.
Dr. Pasqua, I wanted to see we have a number of questions here about masks. I wonder if you could weigh in about kids and masks and what you're recommending to parents about how young they should be when they wear a mask. Is it basically as soon as you can get them to wear one, or what's the directive there?
Okay. Well, according to the last time that I looked at the CDC, it said that children under the age of 5 don't need to wear masks, or if they go onto the plane, they don't need to wear masks. But when I see children come into my office, the kids are all wearing masks. Sometimes it's the children that tell the parent, "Mom, put on your mask." And so the children, whether they're going to be spreaders or not, they're the ones who go with what the parents exhibit, or they go with the role modeling. And that kind of gets down to the whole thing about compliance and wearing masks. One of the things that was said before, that Darlene had mentioned, is that there's some sacrifices that are being made about how to celebrate Thanksgiving and all of this, okay? Just as an aside, we talk about things now being the new normal. No, I don't like the new normal. I want the old normal back, okay? Are we going to be doing this again next year? If we don't want to be doing this again next year, then everybody needs to comply, okay? The adults have to comply so that the children will comply. When the vaccines come out, we need some compliance there. On the aside, if an individual decides, nope, I'm not going to get a vaccine, okay, we need to have that discussion right now. Because when the vaccine rolls out, that's not the time to find out that some people don't want to take it. We need to address those doubts now. And so as far as children are concerned, they will follow their parents' lead. And it doesn't help, it doesn't hurt for a child to wear a mask.
Dr. Green, we have a question for you from Pat on Maui, who says President-elect Biden's new health director wants to shut down the nation for 4 to 6 weeks. Will Hawaii abide by that directive? What are your thoughts about a national shutdown? And, you know, we went through so much pain having gone through 2 shutdowns already. Is that something that you would advocate and agree with?
Let me characterize what I read today, and I am friends with the likely HHS secretary going in. One of the people on the president-elect panel suggested a 4 to 6 week potential shutdown, but then President-elect Biden said that was not his policy or plan, just so people know. We did have an interesting conversation about this not long before the show. We did very well with Safer at Home, which was not a full lockdown. It allowed people to continue to go to work, but it did lower our rates of COVID spread. If we are seeing 200,000, 250,000 cases a day on the mainland, we are about ready to see the whole country go light up with COVID. That would be something that would be so devastating to us that any solution would be better than that. I don't think it's coming. I don't think a full shutdown comes. If any president does make an order, our state will comply. That's the way we are. We're not followers here in Hawaii, but we believe in being law-abiding citizens. Again, I don't think that President-elect Biden is going to choose that route. I think what we're going to instead see from the new administration is the following: a mask mandate, national. I believe we're going to also see a really serious approach to the vaccination program. And I think that the current administration has also been very serious, in fairness to the other party. I think that we're going to see targeted restrictions and extra testing everywhere you go. A national testing plan with contact tracing will do wonders if everyone's wearing a mask. So I don't think you'd have to shut down. But I'll tell you, if we see what we're seeing now, I think we got up to 130 or 150,000 cases today. Hospitals are overflowing nationwide. I'm actually in Washington, D.C. for meetings today and tomorrow. It's pretty disconcerting. We're doing much better in Hawaii, but this wave could come all the way to us west. And I know that Director Char is very focused on that.
Hey, Dr. Char, I'd like to get your thoughts on that. As we see these cases on the mainland, you know, we're seeing over 100,000 cases day after day now. When you see that, what are your concerns for us here in Hawaii?
Yeah, obviously it's very concerning. I think, you know, when the second wave hit, the average daily number of new cases was peaked at about 60,000. We are way beyond that already. Average number of new cases, I believe, was about 111,000 new cases per day across the U.S. So we're already, you know, almost double what we saw in the last peak in the second wave. Very, very concerning. As Lieutenant Governor says, we're trying our best to be safe. We're trying to be reasonable and do what we can, but there's no reason to believe that we're immune from this. And especially, you know, people travel. We have local residents that go to the mainland and come back. We just need to be really, really cautious, because I'm afraid that we'll see our numbers spike as well. So it's scary, but we're trying to do our best.
What are the trends that you're seeing? Where are you seeing the cases originate from most commonly? Is it going out to a restaurant? Is it gathering with family? What is your contact tracing, and what are your investigators telling you?
It's absolutely social gatherings. People are getting together, and oftentimes it's getting together with friends or even family members. So you feel safe because you know these people, and people take their mask off and they let their guard down, and they're not keeping their distance. I think far and away it's social gatherings, and it goes to show us that if we do wear our masks and we do keep our distance, that should help to keep us safe. Even if somebody unfortunately does have infection, that'll help to keep us safe. Keep our distance and wear our masks.
Okay. We have 2 vaccine questions here. Nancy and Heidi, both on Facebook, basically asking, do we have a facility that can maintain the temperature required for the vaccine to be stored in? So Dr. Lara, I wondered if you could answer that.
Well, I think this is actually something that would be better directed at the state officials, because they will be responsible for, I think, helping distribute the vaccine. I think it depends on the product. As I said, there's a number of different candidates. We have just, this week we've heard from the, let's say, most difficult to store product, which is the Pfizer vaccine that has to be stored at minus 70 degrees Celsius. That is probably challenging because you need ultra cold freezers. Those are not standard equipment in the regular kind of distribution of pharmaceuticals or in any medical facility. But I think that, overall, we will be able to have, the distribution and all of those things, the logistical difficulties can be overcome. I think that's not going to be the issue. I think one of the biggest questions will be basically the supply chain. I mean, how much can the manufacturers make, and how many vaccines will make it? Like Dr. Green said, there is, 4 right now in late stage development. There's at least 2 more coming, probably 3. So there could be 6 or 7 different products on the market next year, and some of those will be easier to store than others.
Dr. Green, can you help to give us shed some light on the idea of the refrigeration question? There were a couple of those questions. Do we have the capacity to store the vaccine that we need if and when it comes?
Got this giant freezer in my house. We're going to put 40 vaccines in there. No, we are working on that. We're even gaming out scenarios wherein a plane gets delayed and the dry ice is maybe not going to make it all the way to Hawaii, and other ways to get the medication or the vaccination in this case to us. Partnerships with the military, partnerships with private sector, for every possible scenario to make sure our people can get vaccinated. One of the realities about this vaccine is once it's fully thawed, you only have about 6 hours. This first one, 6 hours to get that vaccination before it, I think the word is denatures, before the vaccine itself is no longer effective. So we'll have to be nimble. I tell you, if we could do it in the jungles around towns in Samoa, we can certainly do it around our state. And we will have to take into consideration our neighbor island communities, which will have great need. We're obviously going to focus on people of highest need first, most susceptible individuals and people that are in the direct line of fire. So it's been very good to hear you have an expert from our long-term care facilities, right? Next year, Christmas will be much better because our kupuna will have had a vaccination and they will not be as susceptible if they choose. And the same can be certainly said of our first responders and our healthcare professionals so that they can take care of people without worrying about getting sick and not being able to give further care. But we'll make it work. We spent 2 hours and 40 minutes just today with experts around the country making sure we're prepared.
Ms. Nakayama, I see the thumbs up there. I'm guessing that your residents are hopeful for that.
Very encouraging.
Right.
I can add on to what the Lieutenant Governor is saying. We can do this in Hawaii. It's going to be very challenging. There are a lot of obstacles and whatnot. But I think the key to remember is that, while we're doing an awful lot of planning right now, this is going to be something that's going to require our entire community to participate. So we're going to need help from the private sector, as well as government, as well as all of our partners, our community, healthcare centers, our private physicians, pharmacies. Everybody's going to need to help and do their part. And we all need to organize and rally together in order to pull this off, because it's going to be a gigantic lift, and we need to be organized. We need to get the buy-in, and we need to have the cooperation and the coordination, but we can do this.
Well, Dr. Pasqua, I want to give you the last word tonight. Something that you said really struck me, and that is that you want the old normal. I think we all want the old normal, and right now, a lot of folks are feeling a lot of coronavirus fatigue. They're tired of wearing a mask. They're tired of socially distanced. They want to see Tutu and Auntie and everybody else. So as we make these holiday plans and we look forward and people do start to get tired of this, as somebody who's been through really what can be described as the worst of COVID, what would you say to our viewers tonight who are feeling that kind of fatigue from all of the stress of the pandemic?
Got it. Okay, so when teenagers come into my office, I tell them there's 3 things which are working in your favor. You got a good immune system, you got some really smart people working on vaccines, and you got some really smart people working on medications. But there's one thing that's working against us. We are an impatient species. We want to go to the parties. We want to take off our masks. At that point, I would say, okay, let's take that impatience and let's shift it. And let's shift it into complying and getting together to take this thing out, okay? We've been doing this long enough, okay? We're going to shift this impatience. We've been doing this long enough. We've been doing this for 8 months now. November, last year, first case there in Wuhan, okay? So a child born like right now, we would like to say to that child, kid, no worry. We're gonna fix this by your first birthday, okay? We've been doing this for 8, 9 months. That's as long as a child it takes to gestate, okay? So we can basically become impatient and just say, we're gonna take this out.
Fantastic.
Let's do this. We turn to each other. Let's say, take it out.
We'll do that together. Mahalo for those words of wisdom, and thank you all for joining us tonight. Of course, we thank our guest, Lieutenant Governor Josh Green, Health Director Dr. Libby Char, UH researcher Axel Lehrer, pediatrician Leo Pasqua, and CEO of Palolo Chinese Home, Darlene Nakayama. Next week on Insights, the coronavirus crisis, of course, has also brought on economic hardship, from the high rate of unemployment to businesses that either can't open or are not able to generate enough revenue with limited service. Join us for COVID-19 economic fallout. I'm Yanji Denise for Insights on PBS Hawaii. Aloha.